Today we deal with the awful factor that many people in the United States are dealing with depression and suicide. This is very, very sad, and it is the second leading cause of death in the United States between people from the ages of 15 to 24. There are 4,500 suicide attempts each year that are successful, and 100 to 200 attempts that go unreported. The vast majority of people who go to commit suicide have been diagnosed with depression first. Depression can lead to suicide attempts because the person feels so hopeless and alone with no hope in sight that there will be an end to their pain. Some of the signs of depression could be extreme hopelessness. You could have a lack of interest in activities that were previously pleasurable. You could have things like maybe someone loved to sing and something happened to where they no longer love to sing anymore. It's either an event or maybe just a sign that for depression. Sometimes you have to pick and choose with this. You have heightened anxiety or panic attacks. I know with stuff like post-traumatic stress, that happens. It's also the case with depression. You have panic attacks if something reminds you of something that's why you're depressed. Many different situations that could cause this. You could have global insomnia if they talk about suicide or have a prior history of trying to commit suicide. That could be a sign. And if you have irritability or agitation, sometimes it could be just a regular bad day. But if it's happening a lot, you may want to look into the fact, hey, are they depressed? Because it could be the difference between saving their life or not. The risk factors of depression or suicide is having one or more prior suicide attempts, having a family history of mental disorder or substance abuse. Maybe your family has a history of suicide, physical, emotional, or sexual abuse, keeping firearms in the household, chronic physical illness, including chronic pain, incarceration, or exposure to the suicidal behavior of others. For the protective factors, you'll have effective clinical care for mental, physical, and substance use disorders, easy access to a variety of clinical interventions and support for seeking help, restricted access to highly lethal means of suicide, strong connections to family, community support, support through ongoing medical and mental health care relationships, skills in problem solving, conflict resolution, and nonviolent handling of disputes, cultural and religious beliefs that discourage suicide and support self-preservation. Teens nowadays that say they are depressed are no longer taken seriously, and this is a very, very sad factor. Many people will be like, oh, well, you and everybody else is depressed, so you can't really be depressed. You know, you're just asking for attention. And some people do ask for attention because they want just someone to pay attention to them. However, this is ruining it for the other people. It may be a common thing, and it may be based off the lifestyle we are living. However, it does not really give us a right to turn our noses at them. If you are turning an eye to someone who is saying they're depressed, turning your head away from them, it's not helping you any because it's not helping your character. It's not helping them any because it's just like, oh, well, they don't care. So they just become more depressed because they aren't getting the help they need. If you know someone who is depressed, you need to stop and you need to help them. You need to find an adult. You need to get them help. You need, and to give them advice of a place to go, maybe a youth ministry, get them medical help if it has gotten to that point. It does not always mean they will end up on medication, but they need to get the help they deserve, because if they stay in this slump, it can get worse and worse and potentially lead to suicide. That is not where you want to be. That is not where you want to see them be. It will hurt a lot of people, lead a lot more people into that phase, and you need to be a help and help stop their depression. You cannot let this continue on.